Once again, I welcome you back to the Nursing Moms YouTube space, and please, if you've not subscribed, kindly do so that we move together as a family. Warm greetings from Nurse Janet. Have you ever heard of a pregnancy called a high-risk pregnancy? What is a high-risk pregnancy? And what kind of situation or condition can put you or your pregnancy to be called a high-risk pregnancy? Pregnancy is termed as a high-risk pregnancy when there is a potential complication that can affect the life of the mother, the child, or even both the mother and the child. And again, there are several things that can lead to this. There are several conditions, situations that can lead to a pregnancy being a high-risk pregnancy. Number one is age. What is it about the age? A pregnant woman below 17 years, that is 17 years and below, and again 35 years and above, that pregnancy is called a high-risk pregnancy. It has high potential of complication. Number two, the preconception weight. If you were underweight before you conceived or overweight before the conception, then your pregnancy too will be termed as a high-risk pregnancy. In underweight, I mean you had a BMI of 18.5 and below, and in overweight, you had the BMI, the body mass index, of 25 and above. Those are risky range of weight, and this kind of pregnancy will be considered a risky pregnancy due to high potential complications. Multiple pregnancy too is another condition that will put your pregnancy as a high-risk pregnancy. If you are pregnant with more than one kid, it can be twins, triplets, or any other number. This number of babies puts your health at risk and even the health of the babies. Hence, your pregnancy becomes a high-risk pregnancy. Existing comorbidities during pregnancy. They can be preconception or even during the gestational period. These are diseases like hypertension, diabetes, depression, any other chronic illness that you had before you conceived or you acquired them during your gestational period. These conditions lowers your immunity, and at the same time, they put your pregnancy at a risk of more complications. If you had problems in your previous pregnancy, that is maybe the previous pregnancy ended up in preterm labor, preterm births, or even births with genetic defects, then the subsequent pregnancy too need close monitoring, and it is a high-risk pregnancy that needs to be closely monitored by a doctor. Other factors that can put your pregnancy to be a high-risk pregnancy include smoking, alcohol drinking, or even use of drugs. These things can put your health at risk and the health of the baby at risk too. When your pregnancy is considered to be a high-risk pregnancy, it's advisable and very important to work together with the doctor throughout your pregnancy so that in case of any complication, it can be easily diagnosed early and prevented to prevent any further complication. Thank you.